Alright, we're going to start our journey of the digestive pathway at the mouth. We're going to start in the oral cavity. And just like when we talked about the nasal cavity, there's so much more going on than just the nose. Oral cavity, same idea. We have a lot to talk about, and some of it's a little bit review, and some we're going to add a little more too. So we'll start with the lips and cheeks. This is going to give us some of our boundaries to hold food into our mouth, giving us our first part of our tube of our digestive tract. So most of that is muscle, and they're muscles that we learned last semester. We have the orbicularis oris going around the mouth, so that forms our lips, and then we have the buccinator in the cheeks, and both of those are going to, one, the orbicularis oris, help keep the food in the mouth, so you use this muscle to keep your mouth closed when you're chewing. And then the buccinator is muscle in the cheeks. Last semester we learned that it helps with compressing the cheeks. So you use this when you're whistling. But the buccinator also, because it can compress the cheeks, can help you a little bit with moving the food around in your mouth. And also, again, giving you a boundary for this first part of our digestive tube. Most of the things we talk about in the mouth, they're going to help with the chewing, the mastication, but they also help with speech. So this picture from last semester, we have the orbicularis oris going around the mouth, so we can see that. Again, helps with puckering the lips, but also helps keeping your mouth closed while you're chewing. And then we have the buccinator, this muscle in the cheek. Again, pronunciation is up to you. Heard that buccinator, buccinator. I like buccinator because it reminds me of the Baconator sandwich at Wendy's. And like I told you in the last video, I like to eat. So that's my favorite part of the digestive system, actually bringing the food in. So buccinator, muscle in the cheek, helps with a little bit with mastication and moving food around. These muscles, they are also muscles of facial expression. So because they're muscles of facial expression, last semester we learned those are controlled by which cranial nerve? So remember, there's one that helps with facial expression. It also helps with taste. That one's cranial nerve 7, the facial nerve. Do you remember the muscles of mastication, the ones that actually help with elevating the mandible for chewing? Now, here's one. It's a huge muscle in your cheek called the masseter. Masseter you can feel right in front of your ears if you put your hand on your jaw and clench your jaw or elevate your mandible. You should be able to feel that masseter muscle contracting right there in the cheek. And the other one was the temporalis muscle right here on the temporal bone that comes down and attaches to the mandible. So if you feel at your temples as you're talking or chewing, moving your mandible, you should be able to feel that temporalis muscle contracting. Since those are both muscles of mastication, what cranial nerve controls them? Muscles of mastication are innervated by cranial nerve 5, the trigeminal nerve. So that one helped with muscles of mastication, also helped with facial sensation, so it helps you with feeling. Alright, so now we're moving into the oral cavity, and we are going to start at the palate. So we've learned with the respiratory system that we have a hard palate and a soft palate, giving us a separation between the nasal cavity and the oral cavity. So the hard palate is going to be more anterior, made of bone, and then behind that's the soft palate. So hard palate, you've seen on our pro sections in the lab. We've also seen the bony portion last semester, so it forms the roof of your mouth. You can use your tongue to squash food against it, also using the tongue to move the food around. Because it's in the mouth, it does play a role in speech. You hit your tongue against it quite a bit to make different sounds. And then the soft palate is posterior to that hard palate, so it's behind it. And that one we talked about also this semester, that the soft palate, along with the uvula, is going to help closing the nasopharynx when we swallow. Right, so that is made of skeletal muscle, you do have control of that. So this picture, if we draw a little line here, you can see the hard palate is again more anterior, closer to your front teeth. You can use your tongue to crush food against the hard palate, and then behind that we have the soft palate and the uvula made of skeletal muscle. Again, closes off nasopharynx when we swallow. So that question's still fair game for our final exam. Tongue is a big part in the digestive system, crushing food against the hard palate, pushing food to the back of the throat for swallowing, moving it around to get it in between your teeth so you can crush the food. Also speech. So tongue should be a very easy tag in the lab. Shouldn't be too hard for you to figure out what that is. But we did talk about the tongue last semester a little bit with our special senses lecture as well as our cranial nerves. So which cranial nerve is going to supply the muscles of the tongue? So again, ones that help you move your tongue around, stick your tongue out at someone. Which cranial nerve is that? Right, so the muscles of the tongue are supplied by cranial nerve 12, the hypoglossal nerve. Alright, so hypoglossal, it helps with tongue movement. Now, which two cranial nerves help with taste? So again, taste, there's two cranial nerves that we talked about last semester. First one was cranial nerve 7, the facial nerve, helps with taste on the anterior 2/3 of the tongue. And then the posterior 1/3 was cranial nerve 9, the glossopharyngeal nerve. Glosso refers to tongue, so it's helping taste on the tongue, and also help with the pharynx for swallowing. Okay, so those cranial nerves, still try to remember those because, again, when you get into those courses later on, nursing courses are going to expect that you know the cranial nerves. If you're going to med school, PT school, wherever you go, these cranial nerves are never going away. They're going to show up on your board exams. You'll see them quite often. So cranial nerves, at least, even if it's not for this class, if you review them before going on to your next step in your profession, please look over the cranial nerves. Alright, also with the oral cavity, we have salivary glands that are going to help. So their job is to produce and secrete saliva. Right, so if I tag a salivary gland in the lab and ask you what is the function, don't overthink it. It just makes saliva. Saliva is actually very important for the mouth. One is going to help with cleansing the mouth, helps you keep that bacteria population under control. It's also going to help with dissolving food chemicals. If you've ever had a dry mouth and tried to eat, things don't taste quite as good. Usually around allergy season, I'm taking antihistamines and decongestants. Seems to really dry out the mouth, and that's worst time for not enough saliva for cleansing the mouth. You end up with bad breath, end up with food not tasting as good. So saliva is very important for that, and it also contains an enzyme called salivary amylase. Typically when you see ACE at the end of these words, think an enzyme. And this enzyme is going to help us with breaking down starchy foods. So in the mouth, we actually are going to do mechanical digestion where we're physically breaking food into smaller pieces, and we're also doing chemical digestion. We have this enzyme to start chemically breaking down food into smaller parts. Right, so again, this is going to be our starchy, sugary foods, breads and potatoes, things that are more carb-filled. Proteins and fats, that's not going to start digesting in the mouth. We'll start chemically digesting that later in our digestive tract. So we do have 3 pairs of salivary glands. We have parotid, submandibular, and sublingual. 2 of those tell you their location. So the first one, parotid gland, we have 1 in front of each ear. So it's sitting somewhat on top of your masseter muscle. And we'll be able to see this in the lab. We do have some dissections where we have the parotid glands dissected out. Again, we have 1 on each side of your face. and it has a duct that leads into the sides of your cheek, right next to your second upper molar. So that's your parotid glands. Then submandibular, if you break down that word, sub means what? Hopefully you said under or below, and then mandibular, below the mandible. So submandibular glands, inferior or below the mandible. Then the last one are sublingual glands, sub, again below, lingual, you think tongue. So sublingual glands are below the tongue. All right, so out of these three, the ones that will be best viewed on prosections in the lab are the parotid glands and the submandibular glands. Sublingual will be on a picture. So here's our picture. We're looking at the right side of this person's face, and it's dissected out to where we can see the ear, we can see the masseter muscle, and right on top that masseter muscle in front of the ear, we have the parotid gland. Right? It kind of looks like fatty tissue right in front of the ear on our prosections. So you'll see that in the lab next week, or I guess depends on when you watch this video. You'll see it in the lab, and again, it sits right in front of our ear, and then we have a duct, this tube, that's going to carry the saliva from the parotid gland into the mouth right at your cheek. So if you've ever had dental work done, a lot of times they'll put one of those little cotton pads in between your teeth and cheek because they're blocking the saliva from this parotid gland. Then the next one, we've taken a chunk of the mandible out just to see a little bit better these deeper structures. But under the mandible, we have this lump of tissue called the submandibular gland. This one you can actually feel on yourself. If you feel under your mandible for a lump on both left and right side, you should be able to feel this on yourself. Personally, the first time I ever felt this on myself, don't laugh, I was a bit of a hypochondriac and thought everything was wrong with me when I was younger. I felt these lumps and thought, oh my gosh, I've got swelling in my neck, I've got these lumps, I'm dying, I've got cancer, something's wrong. Turns out they're salivary glands and they're supposed to be there. They're even size on both sides. They never go away. Shouldn't ever go away. You should be able to feel those. This is one thing that I've heard a lot of our students that work as scribes over at Dayton Children's. They're like, parents bring their kids in quite frequently worried about these lumps under their neck, and the doctor usually will feel it out. Say, all right, you're normal, that's your anatomy, those are your salivary glands. So it's useful to be aware of those so that you don't panic if you feel them on yourself or on your kids. So those are supposed to be there. That one has a duct that comes up right under your tongue. And if you've ever heard of gleeking, where you can shoot a stream of saliva out from below your tongue, it's actually coming from that submandibular gland in the submandibular duct. The last one, you can see the tongue here, so below the tongue we have the sublingual gland. Okay, this is our last one. That one has multiple ducts that come up below the tongue. So the stream from those tiny ducts aren't quite as powerful, so those are typically not involved with gleeking. Alright, this part should be a review. We have the pharynx. Pharynx is our anatomical word for the throat. And we've already talked about the different parts. We had the nasopharynx, we had the oropharynx, we had laryngopharynx. So with our food pathway, food is entering your mouth from the oral cavity. We have a space that divides the oral cavity from the oropharynx, very similar to the choanae that we learned about with the respiratory system. So what is that space called? Remember, food passes through it, so food, F, fauces, F. Alright, so food passes from the oral cavity through the fauces and then into the oropharynx. From the oropharynx, where will that food go next? If you remember our respiratory pathway, it's very similar. We're going from the oropharynx, then to the laryngopharynx. All right. So laryngopharynx, we also talked about, is continuous with the esophagus. So you should have food passing from the oropharynx to laryngopharynx. And what's going to stop it from going into the airway? Why doesn't that food just go down either tube, the respiratory tube and the digestive tube? What blocks the larynx when you swallow? Hopefully you said epiglottis. So epiglottis is still fair game for this final exam for the respiratory and digestive systems. So again, esophagus is going to be continuous from the laryngopharynx, and the esophagus is going to carry that food all the way down to the stomach. If you are in 3120, you are responsible for the epithelial tissue. So it is lined with stratified squamous epithelium, just like the mouth, just like the oro and laryngopharynx. So we have stratified squamous epithelium for what function? Stratified, we have lots of layers. Squamous, they're flat. Places that we have lots of layers, this is for protection. All right, so food's passing through your mouth, through the oropharynx, laryngopharynx, esophagus. Sometimes you swallow food and it's too hot or scratchy, like some chips. So we want this protective lining as food passes through our digestive tract. One thing to note is there's no digestion starting in the esophagus. So it's important that it's specific. No digestion starts in the esophagus, but food is passing through the esophagus from the mouth. So there is still some digestion going on, just nothing new. And if you think about it, in the oral cavity, we produce salivary amylase to start digesting starchy foods. All right, that's going to keep working as the food passes through the esophagus. Salivary amylase doesn't go, oh, we crossed the fauces, we got to stop working now. It's going to continue working as the food passes through the esophagus. So there is still chemical digestion going on, just nothing new is starting. We're not producing any new enzymes in the esophagus. All right, so again, we had food passing through the oral cavity, through the fauces, this dividing line here, into the oropharynx, to the laryngopharynx, and then to the esophagus. So this epiglottis should close off our airway to keep food moving in the correct direction. So if we want to see that pathway of food, we can watch the little marble move from the mouth down to the esophagus. From there, that esophagus is a nice muscular tube. It's going to continue down through the thorax, pierce through the diaphragm, and bring the food to the stomach, which is down in the abdomen. We likely will tag the esophagus in the thoracic cavity. So we'll have one of our donors where the heart and lungs are out, and it'll be sitting right next to the thoracic aorta. And we'll ask you ID structure. Please don't put aorta. If I'm asking for aorta, it's going to be asking you for a vessel. All right, aorta is an artery. It says ID structure, and you have this muscular tube that you see in the thorax, the esophagus. That was one of our more missed questions last year. So if we, again, tag esophagus, ID structure, don't confuse it with a blood vessel. It doesn't look like a blood vessel, but it is often confused. So again, oral cavity, oropharynx, laryngopharynx, esophagus all have the same lining. We have the stratified squamous epithelium. This is the part food would be passing over top. We have lots and lots of layers of cells. And at the top, those cells are flat. So we have stratified squamous epithelium for protection of our mouth, oro and laryngopharynx, and esophagus. I'm going to post this video for you to watch. You can actually see an x-ray of swallowing, so look for that on your pilot page. All right, let's take a break before we get into the stomach.